Thank you for joining us. My name is Nancy Miller, and I am the Director of Education and Research here at the Vitality Institute, the makers of the VI Peel. And today we're going to run through the VI Peel Precision Plus from application to patient selection to aftercare. The VI Peel Precision Plus is a unique blend of the original VI Peel formula combined with a dual booster that adds in a few key ingredients like hydroquinone, kojic acid, really focusing on pigment suppression. The VI Peel Precision Plus is best suited for your patients who are battling issues of hyperpigmentation, PIH, melasma, or UV-induced sun damage. And we know so many of our patients who battle issues of hyperpigmentation are also our patients who are skin of color. So our patients who are Asian descent, Hispanic, East Indian will benefit greatly from this treatment. For our patients who are skin of color and are Fitzpatrick 4, 5, or 6 and are battling issues of hyperpigmentation, we know there are not a lot of safe options for them, from lasers to peels, but with the VI Peel Precision Plus, you can safely treat your Fitzpatrick 1 through 6 and effectively treat the pigmentation issues that they are battling. In your VI Peel Precision Plus kit, you will receive a customized patient aftercare kit, which we will review after the treatment. You also receive an applicator cup that you will put the VI Peel solution in, your 5 milliliter dose of the original VI Peel solution, a dual booster formula here, which includes your hydroquinone and kojic acid, but to it we're also adding a little bit more salicylic, a little bit more retinoic, as well as TCA. Now these will all be mixed into the applicator cup. Your 2x2 gauze to apply, your 2x2 gauze used to apply, your VI Peel Prep Towelette, which is acetone based. Now that you've opened your VI Peel vial and poured it into the applicator cup, you're going to add in the dual booster system. Now the dual booster system contains a lighten and brighten booster. Your lighten booster is the one that has the hydroquinone and kojic acid, in addition to the TCA, retinoic, and vitamin C. To open these boosters, there's a little tab here. Basically, you apply counter pressure from the tab, break the membrane inside, you'll hear that little snap, pour it in, give it a stir, and you'll do the same with your Brighten booster. And your Brighten booster is more salicylic acid. Again, press against the membrane, release the pressure, squeeze it into your applicator cup, and stir. So our patient's skin is cleansed, our peel is prepped. We are going to begin with degreasing the skin. We're going to use our acetone prep towelette to degrease the skin. The towelettes themselves are slightly overfilled, so you want to open it away from your patient's face. You're going to remove the towelette and then place this upright, as there is extra acetone in here that you can use. So you will unfold your towelette. I personally will fold mine into fourths, as I feel I have the best control in that manner. And you're going to begin degreasing your patient's skin on the forehead, the cheek, the neck, or anywhere that you're going to be applying the VI Peel Precision Plus. You're going to use a little bit of pressure. You're going to resaturate if you feel that the towelette is dried a little bit. The goal in the acetone prep is to degrease the skin, and what we mean by that is we want to remove surface oils from the skin that can inhibit the peel's penetration. Acetone is the most optimal solution to use for degreasing because not only does it remove the surface oils, it also dehydrates those skin cells, which allows the peel to penetrate to its fullest. A thorough degrease means there is no sheen left to the skin. We want to see a nice matte appearance across the full canvas of the skin, including the nose, forehead, cheeks, and chin. Wonderful. So we're here with Karuna, and with Karuna we're going to apply the VI Peel Precision Plus. We selected the VI Peel Precision Plus because of Karuna's primary skin concern. Karuna is prone to hormonal breakouts, and for her that breakout goes away quite quickly, but it leaves PIH. And knowing Karuna's East Indian skin tone, she is not significantly oily. We want to focus on pigment suppression as well as relieving her skin of the PIH from those breakouts. At this point, we will proceed with the VI Peel Precision Plus application. We will apply the VI Peel Precision Plus with a 2x2 gauze. I'm going to fold the gauze in half and place it between my forefinger and thumb. We're going to go ahead and saturate the gauze with the VI Peel Precision Plus solution. As you can see, the solution will wick up the gauze very quickly. We want to make sure that our gauze is saturated but not dripping. A dripping gauze means we do not have control over the application process. So once you saturate your gauze, just press against the applicator cup, remove the excess, and you're ready to proceed. When we apply the VI Peel, we're going to apply to the most resilient areas of the face first and assess your patient's skin response. Forehead, cheeks, and then the medial aspect of the face. Our first pass is going to use medium pressure. You're going to sweep the whole forehead, come down the temple, across the cheek, along the jawline, again maintaining medium pressure, to the other jawline, up the left cheek, avoiding the nasolabial folds in the oral area, complete the temporal area. At this point, your gauze is slightly less saturated and you can proceed to do the medial aspect of the face. So you're going to sweep down the bridge of the nose, along the sides of the nose. I'm going to ask your patient to roll their lips for me. Thank you. Upper lip, chin, again, a medium pressure. So our first pass is applied, and what we're going to do now is make 3 key assessments. The first assessment is the patient's pain level. Karuna, how is your pain level now? With a pain of 1 being very little to
0.
The pain level of 0. Wonderful. Her skin response, she's a little bit of flushing, which we would expect to see, and the product has completely penetrated. So in these 30 to 60 seconds, you can complete this assessment and move forward to your next layer. Okay. Do you have any hot spots?
Mm-mm.
All right, so we're going to go ahead and resaturate our gauze for our second pass. Again, saturate your gauze, squeeze out the excess, and we're going to begin on the forehead again. We're going to sweep the forehead in 1 to 2 passes, applying a slightly heavier pressure. As you can see, her skin, I am able to pull it with the pressure that I'm applying. Maintain consistency on pressure as you apply. To the left cheek, bring that down the temple, and again, now that the gauze is less saturated, down her nose and chin. So we've completed our second layer. We've talked to Karuna about pain level. The product has absorbed and her skin response is right on track. So we'll go ahead and resaturate for our third pass. Again, we'll begin on our forehead. This pass you can apply almost a crosshatch pattern from the eyebrows up to the forehead. And I'm going to begin on her left cheek, work my way down, jawline, chin, across back to the right side of the face, down the bridge of the nose, sides of the nose, upper lip, and chin. So that is our third pass. We'll allow the product to penetrate. So after our third pass, we're going to assess 3 key areas. First, the patient's skin response. Second, patient pain level. And third, product penetration. So Karuna, could you tell us your pain level on a scale of 1 to 10, with 1 being very little pain, 10
1.
being the most pain?
1.
1?
Yeah.
Great. As we know, with darker skin types, we won't see as much flushing, correct? Because of the natural melanin in the skin. But we do see a little bit around her nasal area, center of her forehead. Within normal limits, we do catch a little bit of frosting on her forehead. Okay, so we finished our third pass. We're going to go ahead and resaturate and do our next pass, which may be the last pass for Karuna. At this point, her skin has begun to show some frosting on her forehead, and given her Fitzpatrick, we don't want to create further damage or further harm, because we know with our darker Fitzpatricks, they are more prone to PIH. So we're going to avoid her forehead, and we're going to apply the next pass to her cheeks, her chin, and we will do her upper lip and nose. Great. So you can continue to apply if you see frosting. You just want to avoid the areas that have developed the frost. Okay, so we're going to reassess our patient's pain level, skin tolerance, and product penetration. So Karuna, let me know how you're doing pain level wise. 2. Good. All right, and product is penetrating quite quickly. We actually do not have a lot of solution left, so we may get 5 passes for Karuna maximum. And this may be indicative as well why we're seeing a little bit of frosting. And I'm starting to see a little bit along her chin and commissure area. She may be slightly dehydrated. And we know dehydrated skin will absorb the products much quicker. So this is why we're probably getting about 5 layers versus the typical 6 out of a Precision Plus. So now we have finished Karuna's VI Peel Precision Plus application, and we're going to walk her through her aftercare. After the VI Peel is applied, nothing is applied to the skin for the first 4 hours. This includes sunscreen and moisturizers. The acids that you just applied in office can continue to function for up to 4 hours, and we don't want to prematurely halt that progress. So at the 4-hour mark, Karuna will have a little bit of homework. She is going to be using some post-peel towelettes, and they all need to be used within the first 48 hours. At the 4-hour mark, Karuna will start her home care regimen. She's going to use probably 1/3 of the cleanser in this packet. She's going to use cool water, fingertips only, cleanse her skin, pat dry, and she is going to apply the first VI Peel post-peel towelette. Now, I always tell my patients, these are not refreshing towelettes. There's more acid in these towelettes. And what it is extending the treatment that you just performed in office in her home, continuing to stimulate her skin, and it's also creating a very predictable peel for her. Now, Karuna is a darker Fitzpatrick. She's about a Fitzpatrick 5, and during the presentation, she did develop a little bit of frosting on her forehead and a little bit on the cheeks, I would say. So what I'm going to make sure she does do is 10 minutes after that first towelette, she is absolutely going to apply a thin layer of the post-treatment repair cream across her full face, okay? And I'm also going to tell her if she has any irritation, she can continue to apply this. The post-treatment repair cream has a 1% hydrocortisone, which will help suppress the immune response so she does not develop PIH. So it's your little safety net, right? Because we know with darker Fitzpatrick, their melanocytes are very reactive. So we're going to use this as a counter. So she's done her first round of towelettes. Tonight, about an hour before bed, she's going to do her next round of VI Peel towelettes. Again, she's going to do a cool water cleanse with her fingertips only. She's going to pat dry. This time she is going to begin using our VI Peel Precision Plus towelette. The Precision Plus towelette is bringing back those key ingredients that we added into this Precision Plus peel. Hydroquinone, kojic acid, also more retinoic acid in here, as well as ascorbic acid. And now we're adding in hydrocortisone because we know there can be a little bit of irritation and we want to minimize that irritation. She's going to apply the Precision Plus towelette everywhere that we have applied the peel in office, discard it. At this point, she's going to allow 20 to 30 minutes for these ingredients to penetrate and become effective. After 30 minutes, she's going to get her second VI Peel post-peel towelette and apply it everywhere that the peel was applied, avoiding her lips and her eyes. And reapply the post-treatment repair cream from her forehead to her jawline, avoiding her lips and eyes. Tomorrow morning, Karuna is going to wake up. She's going to cleanse her skin. She's going to apply a little bit of the post-treatment repair cream along with the SPF 50. I'm going to have her continue to carry these with her and to use them throughout the day as needed, because tomorrow night she has one last step, and it's the exact same step that she's going to do tonight. She's going to cleanse her skin, use her first Precision Plus post-peel towelette, wait 20 to 30 minutes for these ingredients to penetrate. She's going to follow with her third and final VI Peel post-peel towelette, again, everywhere the peel was applied. Allow that 10 minutes to penetrate, and then she's going to apply her post-treatment repair cream. So basically, these towelettes, 3 intervals, right? You've applied the VI Peel in office. She puts nothing on her skin for 4 hours. 4 hours from application, she does first round of towelettes. An hour before bed tonight, she does second round of towelettes. And then tomorrow night, she does her last round of towelettes. So all towelettes need to be spaced a minimum of 4 hours apart and used within the first 48 hours. The Vitality Institute was created by a practitioner for practitioners, and the VI Peel app is a continued extension of that. We know how difficult it can be to manage patient expectations and answer every question, and this app is geared at being that specialist in their back pocket that they can look to for the most common questions that occur. It also sends them push notifications to remind them of the 4-hour mark and what they should be doing for their skin, as well as the next steps in the process for them.